Okay, week 4, artifacts. As we move on to artifacts, you're going to see that some of these have already been discussed in previous chapters. So some of this will already be reviewed, so it's not really as long as it seems, but we're going to review all of the different artifacts. So first of all, you have to know by definition what an artifact actually is. It's any type of error in imaging. So it's a misrepresentation of the data that shows up on the display. And we can categorize these artifacts into things that show up that are not real, things that should show up but are missing from our display, improper location of structures, masses, or any type of anatomy. The brightness is not correct. It's either too dark or too bright, improper shape, or improper size. So why did these things happen? Well, they happen because of the way the machine is programmed. We've talked already about the fact that the 13 microsecond rule applies to soft tissue only because the speed of 1540 per second is programmed into the system. We also talked about different adjustments that were made, like the depth is linked to the PRP and the PRF to avoid certain artifacts that would occur if it weren't. So let's go over the 6 assumptions or programming reasons the system recognizes something as an artifact, or the reason the artifact may occur. First of all, the machine is going to assume that sound travels in a straight line. What that means is if I send out a pulse in a particular direction, when a pulse comes back, the machine's going to assume it came from exactly where it sent that pulse in. And that isn't always the case, okay? It also assumes that sound travels directly to a reflector and back. We talked about refraction and things like that, so that isn't always true. The amplitude of the returning echoes is directly related to the reflecting properties of the medium. Well, when you have constructive and destructive interference, you're going to get either a higher amplitude or a lower amplitude. So that isn't true. Assumption number 4, sound travels at exactly 1540 meters per second. Again, it was programmed that way. That's why it believes that. We also talked about the fact that the imaging plane isn't very thin, that the beam actually has a thickness to it, right? It has a width. And because of this, we have refraction artifact, because one side usually hits a medium with a different propagation speed before the other side hits. So it isn't thin like the system assumes it is. And that reflections arise only from structures that are along the main beam axis. We also talked about the fact that we have grating lobes, side lobes, because we have little side beams that come off. So these are the 6 assumptions that are programmed into the system. And whenever the echoes don't behave according to these assumptions, we encounter what we call artifacts. And it's your job to recognize when something is real or not real, because we certainly don't want to call something abnormal or a mass when it actually doesn't exist. It's actually an artifact. So that would be a major problem. So we're going to go through some of the most common artifacts. Starting with, and of course this one has a bunch of names. As always, you have to make sure you know all the different names for this type of artifact. But the main name we've been referring this artifact to is elevation resolution artifact. We were talking about if you had poor elevational resolution, that would mean that the height of the beam is tall. Like in this picture on the bottom, you can see the transducer has very tall elements. So of course, the elevational resolution is going to be equal to whatever the height of that beam is, and then it's going to narrow down just like it does with lateral, but we're talking about the height. So the beam if I can draw this, is going to come in like this. And we're talking about resolution this way. And it's also equal to the beam height this time, not the width. So other names for this is beam width artifact, section thickness artifact, or partial volume. I've just seen this on many different review guides or registry review sources, so it's important to make sure you recognize all the different names for elevation or resolution artifact. And again, this is the main one. We're talking about the height of the beam. So this artifact occurs because echoes are received that originate not only from the center of the beam, not only from the axial and lateral planes, but also the third dimension, the height of the beam. And we have a two-dimensional display. So if we have a two-dimensional display and we have a third dimension to the beam, what ends up happening is it's going to look like there's little echoes in what should be nice and anechoic that are coming from the height of the beam that have nowhere to be placed because we don't have a three-dimensional display, only a two-dimensional display. So this is the reason why this is an issue with ultrasound imaging, because we have 2D displays. So one of the things they've done to improve this is the subdicing. That way they can focus in on just particular beams, not echoes above and below that main beam, but the center beam. So this technique was called subdicing, and again, we've mentioned this already with transducers, and that's taking the elements, the very tall elements, that would have a very tall elevation or resolution and cutting them this way. And then, as you can see in this picture, they're focusing in only on the center beams and creating the image. That's going to allow a lot of those echoes not to appear on the 2D display. So the basic way to do well in this section and of artifacts is to be able to answer all of these questions. So this is basically what it looks like. If you look at this picture here, we have a bunch of echoes in both of these, what should be fairly anechoic structures, okay? And how do we get rid of this? We talked about technology improving with subdicing. So first of all, we ask ourselves, what causes this artifact? Well, what's causing this artifact is very tall elements, okay? So tall elements would be the reason we have elevational resolution artifact. What does it look like? Echoes and what should be an anechoic structure. So if this is supposed to be nice and black and we're seeing a bunch of echoes in it, it could be due to elevational resolution. This is just one of the artifacts that causes echoes in anechoic structures. Where would you see it? In fluid-filled areas, okay, most likely. How can you improve it or mask it? Now, this is a question where sometimes we can't do much about it, so we're going to try to mask it. We can't really get rid of it, so how can we improve that image? If you remember, we have a control called reject that gets rid of low-level echoes. That's one option. That's sort of masking it, right? They're going to be there. We're just erasing them from the display. So reject is one of the buttons we can adjust and get rid of some of those echoes. We can always focus the beam. That's really just going to improve our lateral resolution, right? We can turn down our gain. That's going to mask it as well. So these are different things that we're going to adjust to make this look a little bit more anechoic, because we know they're artifacts and they're not there, so we want to get them erased from the display the best we can. So how has technology improved to reduce this artifact? We talked about the subdicing. Right, that's when it cuts the elements so that they're not as tall. And what assumption does it violate? And I'll let you refer to all the assumptions. They're on page 359. But basically it violates the assumption that the imaging plane is very thin, when in fact it isn't always thin. It can be tall or it can be wide. So that would be the main assumption. And it's not that it's that important that you know those assumptions. You're not probably going to be asked on a multiple choice registry question, what assumption does it violate? But it's good for you understanding how this works. And I expect you to know the different assumptions for my quiz. Okay, the next one, acoustic speckle. Speckle artifact is the result of constructive and destructive interference. Okay, this is what causes that grainy appearance we see in tissue. So if we didn't have constructive and destructive interference, our tissue would look a lot smoother, sort of like this middle image here. Our liver would have more of a consistent shade of gray, or it could look more like this. This is just a little bit brighter, but much smoother. But most of the time, our liver images or any organ images are going to have a variety of different amplitude echoes. Some that are like little dark spots like this, or some that are much brighter, like this tissue here. Okay, so we're going to get this because of constructive and destructive interference. So what causes it? Again, constructive and destructive interference. What does it look like? A more grainy appearing, multiple different amplitudes of gray instead of one solid gray. Where would you see it? In any tissue, any organ, any solid organ, such as the liver, as an example. How can you improve it or mask it? You can't do a whole lot with it. You can adjust your dynamic range a little bit. Okay, if you want to adjust your dynamic range and increase that range, you'll get a more smooth appearance, more shades of gray available, and less black and white. Okay, so you can increase your dynamic range if you wanted to mask it a little bit. There are also black and white map options. This is just cosmetic fixes. It's going to happen regardless. And what assumption does it violate? I would say in your book it's number 6. The strength of the reflection is related to the characteristics of the tissue creating the reflections. Well, again, if this is all the same consistency, this should be one solid shade of gray, when in fact you've got little bright spots like you do right there, a little white spot, and you got some little darker spots. I don't know if you can see this, but we're talking about not the obvious things that are coming from blood flow, like this is a dark spot, but this is because that's a vessel. And then there's a bright spot here because that's a wall, but we're talking about just the liver itself. There's little dark and bright spots in that. Noise or interference. Noise is just a blanket term to cover a lot of different things. Anything sort of undesirable, whether it be in a Doppler display or your 2D display that looks like some kind of interference, they might refer to it as noise. So be careful with this term noise. It's a blanket term that covers a lot of different things. So noise on the display that comes from electrical interference could look just like if you had a television set and you had a vacuum cleaner going at the same time, you saw a bunch of lines and stuff on there. That would be some type of electrical interference. You may or may not be able to do something about it. Sometimes when you go to the ICU unit and you plug in your machine there and there's a lot of other machines operating at the same time, you might get a little bit of electrical interference they might refer to as noise. On the Doppler spectrum, sometimes they refer to noise as, the exact name should be clutter, okay, on the Doppler spectrum, but they might refer to it as noise. Noise on the color spectrum might also be referred to as ghosting or color bleed. They often use noise to cover these 3 different types of artifacts. So again, the exact term would be clutter. So clutter is, by definition, high amplitude, meaning it's bright, high amplitude, low velocity, that means it's slow. See how it's really bright here? But yet this is a velocity scale with velocities up the y-axis here. Okay, if this is like 100 centimeters per second, and you take this and over here, and this is only about 20, usually wall motion is slow, but it's bright. That's why they refer to it as high amplitude, low velocity signals. How do you get rid of clutter? You increase your wall filter. But we don't want to increase it so far that we eliminate half of our signal. That would not be beneficial. So sometimes we have to live with a little bit of clutter just because we don't want to erase any of the true signal. Now, the same artifact, when it occurs with color, we call it ghosting, or they might call it color bleed. When you see this little bit of like what looks like flow, but outside of the walls of the vessel. Again, the way you would fix this is increase the wall filter. And you don't want to filter up too much, because if you filter too much of the signal, you're only going to have flow. And let's see, I'll change the color here. Let's say if your wall filter was set too high, you'd have flow, but it would only be in the center of the vessel, and it would be very dark along the walls. That means that you've increased the wall filter just a little too high, that you're not actually getting proper fill in to the wall. See, there's a void area here and here. That would be a wall filter that's set too high, and you would have to lower that a little bit. If it's bleeding outside, you increase the wall filter. Crosstalk, this is what you get when you have a poor Doppler angle. So if you're scanning a vessel, and when we say poor at 90 degrees, and our gate is in the middle of the vessel, what happens is the walls move this way and they move this way at the same time, right? Both walls are going towards A. As a pressure wave or flow goes through the lumen, it puts pressure on the walls, and they move outward and then inward. So they're actually technically moving towards the transducer and away at the same time. Therefore, if this is your zero baseline right here, you're going to have the same amplitude signal on the positive side and the negative side. See how it's bright on both sides? That's what we refer to as crosstalk. And the only way to avoid this and fix this is avoid 90 degrees. We do not want to scan at 90 degrees, because that wall is going to be moving towards and away from our gated section. Now, spectral mirror is a little bit different. If you notice, and how you can tell the difference between this and crosstalk is the amplitude of the real signal is much stronger than the mirrored signal. This is much weaker. So to get rid of this, you would simply turn down the Doppler gain, not just the grayscale gain. There's a gain for Doppler, color, and grayscale. You would turn down the pulse wave Doppler gain. And by doing that, you're going to get rid of that mirrored image. Okay, so you turn down, oops, about the R. Turn down your Doppler gain. That's going to erase and eliminate the bottom part of the display, because that's a lower amplitude signal, and you should only have the stronger amplitude signal remaining on your display when your gain is set too high. And again, we're talking about the Doppler gain, because we're actually looking at a Doppler spectral display. Aliasing, we've talked about this many times. The way to get rid of aliasing is to increase the PRF. Now, there are some cosmetic fixes, like you could shift the baseline down a little bit. So even if we shift this baseline down, we're still going to have probably about this much aliasing left. So that's only going to fix a little bit of the signal. So ultimately, you're going to have to go back and switch to PRF. And plus, you never want your zero baseline at the bottom, because if there is some negative flow or flow going in a different direction, you're not going to be able to tell directional information if you don't put the zero baseline at least near the middle. It doesn't have to be completely in the middle, but near the middle, so we can see if there's flow on both sides and direction of flow. Because Again, if a signal shows up on the positive side, we know it's going towards the transducer, and if it shows up on the negative side, we know it's going away. So we need to be able to differentiate positive from negative shifts. Reverberation. This is a wordy definition, and the reason I have these wordy definitions, they come from the book, and sometimes the registry has very wordy questions. So to be prepared for those wordy questions, you want to kind of understand this verbiage. Unfortunately, it could be summed up a whole lot easier, but I'm going to read this through to you. So reverberation is the most common artifact that results off gas-filled structures or strong reflectors. Okay, and usually these gas-filled structures are probably small little bubbles, okay, little gas bubbles, or strong reflectors. They could be things like artificial valves in a heart, valve replacements. They could be staples from a surgery, something synthetic in the body that's a strong reflector. Or if you have a vessel very close to the surface, you might end up with reverberation, but you probably won't be able to recognize that because your depth won't be deep enough to see those lines. So what does it look like? It's demonstrated as equally spaced parallel lines with diminishing intensity. So as the lines start to go down, they get weaker in amplitude. I can't show that in this picture, but they're going to get weaker as they go down. So what happens is a pulse is transmitted from the transducer, and a strong echo is generated at the real reflector. So it hits a really strong reflector, and most of that sound beam comes right back to the transducer. So if our transducer sends in a sound beam, and there's a very strong reflector very close to the surface, a large portion of that is going to be reflected, and a very small portion is going to be transmitted. And then the transducer, being a strong reflector as well, reflects a large portion right back into the body, and a little bit, goes back to the system. And this starts going on and on, ping-ponging effect, until it eventually just wears itself out. So I'm going to read the second part of it. It says a strong echo is generated at the real reflector and is received by the transducer, allowing correct representation of the reflector. So the first line is the actual reflection. The echo, being so strong, is partially reflected at the transducer, so that a second echo is received, as well as a third, fourth, etc., until again that sound beam totally weakens out. Because these echoes arrive later, they're going to appear deeper on the display. So what does this look like? See, there's a strong reflector here, and then you see another one, and then another one, equally spaced, and then it gets weaker and weaker as it's going down, okay? Or in the case of this is a needle during a biopsy, this needle's coming in here, okay, this is the real reflector, but it's such a strong reflector that a second echo comes in, and you see these little lines here, but they're getting weaker and weaker. This is what we refer to as reverberation. So what causes it? Well, basically the sound beam gets stuck between two strong reflectors, and it keeps bouncing back and forth until it eventually diminishes. So two strong reflectors trapping a sound beam is what really causes it. What does it look like? It looks like equally spaced lines. They refer to it as a ladder sometimes. And the spacing of the lines is equal to the two strong reflectors that trap the beam. So if they're spaced far apart, your reverberation is going to be far apart. If the two strong reflectors that are ping-ponging that sound beam are really together, like say it was a teeny little microbubble, the spacing is going to be equal to the spacing of the walls of this bubble. So it's going to be more like this type of spacing, equal to, again, the two strong reflectors that cause it. Where would you see it? Anywhere you have two strong reflectors. How can you improve it or mask it? Actually, this is one of the artifacts we don't try to get rid of. We actually, it's actually useful, because what it does is it's telling us that we're looking at something that has a very strong reflection. So sometimes when we're looking for lost surgical clips or pieces of a needle or something synthetic in the body, maybe an IUD, we're going to see reverberation off of it, and it's going to be really bright. So that's kind of telling us, hey, that's where it is. I can see it. Or if we're looking for little air bubbles in a place they shouldn't be, like if there's bubbles in the common bile duct, like air bubbles, you're not supposed to have air in there. So that kind of tells us, hey, this is air, or this is a strong reflector, something synthetic like a replacement valve or an IUD. So sometimes some artifacts are actually useful and they help us prove our case. If we're saying, hey, yeah, I found that IUD, it was way off in the fallopian tube, you know, you're going to be able to identify it by its bright reverberation coming off of it. So sometimes we don't want to improve it or mask it. And what assumption does it violate? I would say that reflections arise only from structures positioned in the main beam axis. No, I guess I would go with more of the strength of the reflection is related to the characteristics of the tissue creating it, or that sound travels directly to a reflector and back, because it can go there and back and there and back and there and back. So there's a couple that it might fit into. And again, it's not so important that you know what assumption each one violates, but that you do know the assumptions. So sometimes they fine-tune reverberation and have different names for it. If they call it Comet Tail, they're calling it that because it fans out. It gets wider as it goes out. Basically, the only reason it's getting wider is because our lateral resolution is getting worse. So if you could actually see the beam, it's a kind of a way of seeing our natural beam. It widens out here, and this is referred to as Comet Tail. It starts off small, more of a pinpoint area, and then it gets bigger as it goes down. So that would be Comet Tail reverberation. Things that typically cause that are fairly large, like synthetic replacement valves, heart valves, might cause a Comet Tail reverberation. Ring down is usually caused from something very small. Let's say there's a teeny tiny little micro bubble here, and it looks like a continuous line when I call it ring down. So it comes to sort of like a little pinpoint, or it looks straight, because the spacing between each line is so close that you almost can't tell that there is a space. So it looks like a continuous line. So this is the type of reverberation they refer to as ring down. Mirror image artifact. This is created when sound reflects off of a strong reflector, which then redirects the sound beam, and it ends up showing structures that exist on one side of the strong reflector as also being present on the other side. So the one before the mirror type reflector is the real structure, and the one on the opposite side of the strong reflector that's acting like a mirror is the artifact. So the artifact is always going to be deeper. Sometimes they ask you questions about how they categorize the artifacts as to, are they lateral artifacts? Are they vertical artifacts? Is the real artifact going to be deeper or shallower? So make sure you know that kind of stuff. The artifact is going to be deeper on the opposite side of the strong reflector. So mirror image artifact is very common around the diaphragm because we have air on the other side and we have a strong reflector. So the diaphragm and the air together make that a very strong reflector area. And two reflections are going to be seen on the image. The artifact is the deeper one on the display. And let me show you what this looks like. All right, so basically what happens is as our sound beam comes in and it encounters the strong reflecting diaphragm, and then it goes off to the side and it hits a structure, and then it comes back where it went in. Now the machine is going to assume, okay, that even though this came off from the side, that it's along the path of the beam, because it thinks that sound travels in a straight line, right? That's one of the assumptions we talked about. So if sound were to travel in a straight line, you have to add this amount of time to the travel. So the machine thinks it went in and it traveled as long as this white line is. Okay, and it's going to place the artifact here. This section here is going to position it just that line down there. So remember, when our beam comes in, though, we have multiple beams coming in. So we're going to have a beam that comes in that's going to create mirror image. And let me change the color of that. So as the beam comes in here, and we have a mirror image going on, and then the real beam comes in, and it comes back and places the real object where it is. So the fact that we have multiple beams coming in, this first beam here created the mirror image. The second beam created the actual image. I know that looks messy. So this is the mirror image beam that comes back like this, and then the real beam came in and created this. So what causes it? Well, this would not even happen if we didn't have a really strong reflector and a little bit of an angle to our beam that caused the sound beam to be redirected in this direction. So a strong reflector reflects the beam off to the side. That's typically what causes it. What does it look like? Well, you're going to see a real reflector and a mirror image of that reflector. So the real structure here, and then a mirrored image of that structure. And it's the key is something caused it. So the cause is this very strong reflector that's between those two structures. So a common location is, again, you've got the lungs here, lung being air, very strong reflector, right? Liver, which is soft tissue. So this is a very common location for mirror image, the lung-liver interface where the diaphragm is. So this is the actual ultrasound picture where you have, here's the mirrored image up here in the lungs. It looks like there's a mass in the lungs, but there isn't. It's actually just a mirror image of this real structure right here. How can you improve it or mask it? Honestly, all you have to do is scan and change your angle and move around, and it'll disappear. So it'll go away as fast as it shows up. Sometimes, and that's the reason why we always look at things in more than one imaging plane, to prove that it actually exists and it isn't something like a mirror image. And what assumption does it violate? That sound travels directly to a reflector and back, and that isn't always the case. Multipath is just like mirror image. The only problem is there's only one reflection on the display. You don't have a real structure and an artifactual structure. You have one real structure being displayed deeper than it should actually be. So you can't really recognize this. It just happens sometimes and you wouldn't even know. The only reason you need to know multipath is because sometimes they use it in a group of artifacts to say, for example, a question would say, all of the following artifacts will display artifacts deeper than they actually are, except, well, they'll use this probably as an answer choice because it will display a structure deeper than it actually is, just like the mirror image will. Okay, so they'll kind of group it as an answer choice. But you can't ever honestly confirm that this is occurring other than if you scan and then notice that the same structure is now a little bit closer than it used to be, then you'd know, well, that I probably encountered some path. Refraction artifact, we've been talking about this a lot. We talked about it when it occurs with Doppler, and we said it was referred to as critical angle artifact. When it occurs with grayscale and the refraction is towards normal, as quantified by Snell's law, then you're going to see two structures side by side. But when it occurs and it refracts away from normal, on the display you're going to see an edge shadow. So I'm going to show you in the next two images exactly what refraction looks like when it's towards normal versus away from normal. And you need to be able to recognize both of them as refraction artifact. They don't care whether it's towards or away, they just need you to recognize what you're looking at and what kind of artifact it is. So what causes refraction? We've already talked about the fact that there has to be an oblique angle and a difference in propagation speeds. Okay? You can't have refraction with normal incidence, and you can't have refraction when the propagation speeds are the same. So there's a couple of ways it's going to show up on the display. One way is you're going to see two artifacts side by side. That's when the refraction is towards normal. Or you're going to see an edge shadow, like off of the side of a cyst, okay, a dark spot, when the refraction comes in like this, and it refracts this way, away from normal, and none of it comes back to the beam. It leaves a shadow or a void where the sound should have reflected. And they say that this degrades lateral resolution. I know that Edelman mentions this a lot in his book because I think it shows up somehow on a registry question. I guess they mean it degrades your lateral resolution because it gives you a false representation of two structures being side by side, like in this next picture. So this is a uterus, and I know you don't know what you're looking at yet. And this is a little gestational sac. And here's another gestational sac side by side. Now this is actually a real twin pregnancy here. But the artifact might look very, very similar. You may not know whether it's real or not. So the best way to figure out whether or not you're dealing with refraction that has gone towards normal, when you have refraction, when it comes in at an angle, okay, let's see, if the beam comes in, and then it refracts in a way when it hits an interface towards normal, you're going to get, again, multiple beams are coming in. You have a beam that comes in this way, and you're going to see the real reflector. So you're going to see the real reflector here if the beam came in straight. And then if the beam were coming in off the side, but it reflected this way, you're going to see the duplicate structure. There's no way of telling which one is real and which is a duplicate, but you're going to get a side-by-side presentation of something. So if this is the real structure and then the beam refracted towards normal, it's going to produce a side-by-side duplicate structure. Now, again, what causes it? An angle and different propagation speeds. What does it look like? Well, if the refraction is towards normal, you will see a side-by-side duplicate structure. Where would you see it? Around areas where a lot of times we see it with babies because there's a soft tissue interface. Sometimes there's bone because there's so many different types of tissue. There's fluid in the gestational sac. So you're dealing with a baby with a lot of different components that have different propagation speeds. Bone is very different from fluid. So you're going to encounter refraction more likely with pregnancies. And again, they'll go away as fast as they show up if you change your angle. So you would know whether or not, hopefully, this is real by imaging it in more than one imaging plane. You do a sagittal and a transverse view to see if this is actually real. So how do you improve it or mask it? Change your angle. And what assumption does it violate? That sound travels in a straight line? Well, no, sometimes it goes off to the side. Okay, it might. Or sound travels directly to a reflector and back, not if it bends or turns. So kind of both of those. And this is refraction edge shadow. See what you have here is you've got fluid. And then this entire thing is a baby's head. This is a cross-sectional cut through a baby's skull. And If your sound beam comes in at an angle, and there's fluid here first of all, and then it hits bone, one side hits bone, and then it refracts off to the side, you're left with a void right here where that sound beam should have recorded echoes. So you get an edge shadow. Now you'll see there's one on this side of the skull and one happening on this side because we were scanning at different angles and the beam refracted totally internally, kind of like what happens with Doppler, except we only refer to it as critical angle artifact if we are talking about Doppler. If we're talking about grayscale, we refer to this as refraction edge shadow. So this is refraction edge shadow. And this occurs because the refraction went away from normal and it cast a shadow because no sound beam was able to get through to this tissue. Side lobes and grating lobes, we've covered this many times. Hopefully you're very comfortable with this. Know that side lobes come from single element transducers. So think of two X's, side lobes, single element. And grating lobes come from phased array transducers. I'm not going to read this to you because we've already covered this before, but you can see that the reason they occur is you've got a main beam, and then sometimes when that beam is so strong, you get these little side beams. And when these side beams encounter something, let's say like a cyst that's very close to the surface, it hits the walls of that cyst and it creates a reflection. So if it hits a bright reflector here and then it goes back to the sound beam where it originally came in, it's going to place that strong reflector right in the middle of that cystic structure, and it's going to look like lines. So here's what your image will look like with side lobes or grating lobes. Little lines that kind of show up like this. Typically, you'll only see close to the surface of the transducer. And since we're only using phased arrays, you're only going to be able to recognize it with your phased array transducer. So those would be called grating lobes. If it was old technology, then it would be referred to as side lobes. So what causes it? Side beams that come off of the main beam axis. What does it look like? Little lines or echoes in an anechoic structure close to the surface. Where would you see it? Same thing, something like a gallbladder or a cyst that's very close to the surface. And how do you improve it or mask it? Or how has technology improved or masked it? Was able to mask this? Apodization. That's where you apply a stronger voltage to the inner elements. Because remember, if you've got a bunch of elements, right? When we're using a phased array, what you would do is apply strong voltages on the inside elements, and then the outside elements get a very weak voltage, very low voltage. That way you have a strong center beam without any side beams coming off. This assumption it violates the assumption that reflections arise only from the main beam axis, when in fact that's not true, because there are sometimes some side beams and we get reflections from those. So remember, apodization or apodization, however you want to pronounce it, is the voltages of each crystal, so that the strong voltage is in the center, weak on the outside, therefore avoiding side lobes or grating lobes from coming off. Propagation speed or range error artifact. Okay, this is caused by the programming of the system to propagation speed of only 1540. So when the system has a speed, sorry, I had to answer something. when the propagation speed is programmed into the system at 1540 and you're traveling through a structure that is a propagation speed other than 1540, it's going to place your echoes either too close or too far away from the display, depending on whether the speed was faster or slower. So, for example, and this happens sometimes when we're scanning people, and let's say we're scanning here in the neck, and there's a lot of muscle here in the neck. Now you need to know that muscle is faster, okay? And here's our actual vessel. So if you're scanning through a lot of muscle, and muscle travels faster, it's going to go there and come back faster. So if the propagation speed is greater than the 1540 that's assumed by the machine, then that increased speed will cause the echoes to arrive sooner, and it will place our structure too close on the display. So what would happen is on our display, this vessel that's down here might be placed a little closer than it actually is in the body because of all this muscle in here. Let's change that. So let's say this is all the muscle here, okay? If it travels through muscle, it's going to place structures closer than they actually are because muscle has a propagation speed faster than 1540 that's programmed into the system. And then let's say same scenario, but this time you're scanning through a patient who has a lot of fat. So let's say there are kidneys here, but there's all kinds of little fat lobules here. Lots of fat on this person. Okay, a very fatty person. The fat is, the sound beam is going to travel a lot slower through fat. So it's going to go in, but it's going to take time, and it's going to come back a lot longer than we would expect because it's traveling through fat. As a result, on our display, if something is traveling slower than the programmed speed, it's going to come back after a longer period of time, and it's going to place things like, if this is a little kidney here, it's going to place that structure deeper on the display than it actually is. So our kidney would be positioned deeper if we were scanning through a person with a lot of fat because it's traveling at 1450, which is slower. And remember, everything is placed according to the round trip travel time. So if something comes back in 13 microseconds, it's going to be placed at 1 centimeter in the body. But let's say it comes back because it was traveling through fat. Even though it's 1 centimeter in the body, it might, if it comes back at 26 microseconds because it's traveling so slow, it's going to place this at 2 centimeters in instead of 1 centimeter in. Why? It's programmed that way. So here's what it actually looks like. Here we have, this is the diaphragm, we have liver, and this is the diaphragm. And it doesn't look like the diaphragm is matching up in this picture. Same thing with this bottom one. We have diaphragm here, and then we have a piece of the diaphragm that's positioned deeper than it should be. Why is this happening? Well, it's kind of a helpful artifact in this particular example because it's telling us that this structure right here, this mass, is most likely a fatty mass. It's a liver mass, and that means that the sound beam is traveling a lot slower through here because it's traveling at 1450 instead of 1540, right? It travels slower, so it's going to position everything along this section and below it deeper than it actually is. So therefore, the diaphragm is not hooking up because we're traveling slower for a period of time, and everything along this beam here is going to be positioned deeper on the display than it actually would be. Therefore, this piece of the diaphragm is deeper than the rest of the diaphragm. It doesn't seem to connect. That's known as propagation speed artifact or range error artifact. So what causes it? A speed other than 1540. What does it look like? Well, either objects are going to be positioned closer than they actually should be or deeper than they actually should be. Now, deeper is when the speed is slower than the 1540, and closer is when the speed is faster than 1540. Where would you see it? Well, again, probably when you're dealing with a lot of muscle, fat, or even fatty tumors. How can you improve it or mask it? You don't actually want to. It tells us something about the structure that you're scanning through. And what assumption does it violate? Well, that sound travels in soft tissue at exactly 1540. There is no exact 1540 because that is the average speed of all tissue in the body. It's a made-up number, and we call it soft tissue, and it's specific to ultrasound. Range ambiguity, we don't have to worry about this one because the PRF is automatically linked to our depth button. If it wasn't automatically linked to the depth button, then when we were trying to image deeper, let's say we wanted to penetrate 10 centimeters, but we didn't adjust our PRF or our PRP time. We didn't listen long enough, and we kept sending in another signal. What will happen is by the time the echoes coming back from the deep structures from the first pulse arrive, a second pulse was sent out. And what the machine's going to assume is those deep echoes that came back came from the second pulse. And then it's going to position deep structures closer than they actually are. So the good news is, and we've gone over this formula so many times, the depth button is automatically linked to the PRP and the PRF. So we don't have to worry about this happening. We just need to still know that this is why it's linked. Because if it wasn't linked and we sent in, and let me see if I can draw this. We sent in an echo and we were trying to go 10 centimeters deep. And then we have a bunch of reflections that are coming back, okay? Coming back from up here, but also the deep ones. If we send in a second pulse, and these deep reflections meet that second pulse, but they actually were reflections from the first pulse, the machine's going to say, oh, wow, these came back really quick, and place 10 centimeter structures. Let's say there was a kidney here, way up here on the display. But again, it's something you don't have to worry about. You just need to know the definition and know what would happen if it wasn't linked automatically for us. So what causes range ambiguity? Well, it would be if a second pulse were to be sent out before all echoes return from the first pulse. That's what would cause it. What would it look like? Deep structures actually appearing closer than they actually are. So it's a vertical misrepresentation of data. Deep structures would be positioned closer. Where would you see it? Well, we would see it anywhere, so we don't have to worry about that. How can you mask it or improve it? It's already linked with the depth button, so you don't have to worry about that. And what assumption does it violate? I'm not really sure. That sound, well, it's not that sound travels at 1540. That's not the case. I'm not sure it really violates any of those assumptions. No, it doesn't really violate any of those. So no worries about that one. Shadowing. Shadowing is the reduction in echo amplitude from reflectors that lie behind a strongly reflecting or attenuating structure. Is that wordy? Yes. Do you need to know that verbiage because it's going to be phrased that way on quizzes? Absolutely. Okay, so what it's basically saying is if we send in a sound beam and it hits a structure that's a strong attenuator, let's just say we're dealing with, here's a rib. Okay, that's a terrible picture, but if we send in a, oops, I don't know why it's doing that. We send in a sound beam and it hits a rib, this is going to suck up that entire sound beam by absorbing it, right? So if it absorbs the entire sound beam, there's nothing left to travel further. So the only thing you're going to see on the display then is a shadow or a void in this location where the beam was never able to penetrate through this strong attenuator. So it leaves a shadow. So let me show you with the picture. It's a little bit easier to see. What causes shadowing? Strong attenuators. So in this picture right here, you can see this is the gallstone right here in the gallbladder, this bright echo. When the sound beam came in, gallstones absorb the sound and they also reflect. Those are two types of attenuation, to absorb or reflect. So therefore, if it absorbs or reflects the sound beam, there's nothing left or remaining. So when our sound beam came in, it wasn't able to pass through that strong attenuator, leaving a void on the display or a shadow. So where would you see it? Directly behind strong attenuators. How can you improve it or mask it? Well, if it was a rib, we can use, some of our enhancement tools like the Sono CT, where we can get behind those ribs by coming in at different angles. That's one thing you could do. But in a case like this where you're trying to prove to the radiologist that this is in fact a gallstone, we know that gallstones are strong attenuators. So we actually want this shadowing to prove that that is in fact a gallstone. Other things we want to do are make sure that it rolls to the dependent portion, that it is mobile and it moves, things like that you'll learn when we get to pathology classes. So we don't really want to get rid of shadowing on the display unless it's obstructing something we're trying to look at. So what assumption does this violate? That the strength of the reflection is related to the characteristics of the tissue creating the reflection. Well, obviously, this amplitude here is not a true amplitude of liver, because liver should look like this. The only reason it looks black is because the sound beam wasn't able to get through to this portion of the liver. So enhancement is exactly the opposite. It's an increase in echo amplitude from reflectors that lie behind weakly attenuating structures, or basically structures that don't attenuate or attenuate very little. But it's interesting because enhancement is actually much brighter, in fact. And the reason that is if you remember, we talked about internal compensation, and then we talked about TGCs, that are the little slide pods that we often add to the display that account for attenuation due to depth. So when we encounter a structure, that's mostly going to be fluids. Fluids tend to not attenuate that much. So when the sound beam comes through this fluid, and if we were looking at liver, let's say on both sides of this area below this weak attenuator is going to be much brighter than the liver right next to it. So if it came in at a power of 10 here, and then as it encounters the liver, it goes down to a power of 9, 8, this is terrible, these numbers aren't showing up good, 7, and it's getting weaker as it goes down the display. When it encounters cyst, though, it doesn't weaken, so it comes out at a strength of 10. And then it goes down to 9, 8. Now, again, the reason for the internal slope or these TGCs is to account for attenuation. So if we only have a strength of 6 in the liver at the bottom of the display, we're usually going to add about 4 decibels, right, to bring that back up to a power of 10 instead of 6. But we can't tell it to just amplify the liver to the left of this enhancement. This structure that has a power of 8, this part of the liver down here at the bottom, this is so hard to do this without having the right tools. But if this is a strength of 8 and this is a strength of 6, we want to add about 4 decibels to bring it back to 10. But do we really need to add 4 to 8? That's going to give us a strength of 12 at this location, right? So if we give this section a strength of 12, it's going to be much brighter than the surrounding tissue. And that's why you have enhancement behind these weak attenuators, because we have an internal slope that adds compensation, and then externally with our TGCs we add compensation. So on the display, this area right here is much brighter. Now this you may not know, but I'm going to tell you, right here is a piece of muscle. We're looking at a breast with a breast cyst. This is muscle. And this muscle strare, this shade of gray, let me change the color. This shade of gray in the muscle and this shade of gray in the muscle are different. They should be equal. This section is much brighter because of the enhancement and the added amplification or compensation to areas that didn't necessarily need to add compensation to. Then we have something called focal banding. This artifact usually occurs at the focal region. What happens is we're increasing the intensity when we add focal zones. So when you increase the intensity or decrease the area, the intensity goes up. So basically, let me see if I can show you better on the picture. If you add 2 focal carats here to this little area, and this is a testicle, by the way, and you might not be able to identify or clearly see this, but this shade of gray is slightly darker than this shade of gray where we added focal zones. Well, what are we doing? We're actually narrowing the beam through this section here. So the beam might have been a little bit wider, and then when we add the focus, we narrow the beam. So if the area decreases, it has an inverse relationship with intensity, right? Because this is the intensity formula. So if the area decreases, the strength increases, and we get a brighter amplitude through this particular section that happens to be focused. So what causes it? Basically, when you focus, okay, that's why they call it focal banding, you decrease the area. What does it look like? A brighter section. Let me clear this. This section of the testicle is brighter than the closer section. The area where we have the little focal carats becomes brighter. So where are you going to see it? In the focal zone or where you add focal carats. How can you improve it or mask it? Well, if you want to make this more uniform, you might want to focus the entire testicle. So you'll get the same narrowed effect all the way down, a very narrow beam, and the same shade of gray throughout that testicle. And I'm not sure what assumption, let's see, this violates. The strength of the reflection is related to characteristics of the tissue creating the reflection. So the last assumption. So this is the last artifact. So again, some of these things we've already covered, so hopefully this clarifies some of that, that chapter for you. And if you can answer most of these questions, you should do fairly well with the artifacts section.